I've been looking for a treatment for diabetic patients with peripheral neuropathy. I've been looking for a treatment protocol for them for years. And through an associate, I was introduced to the Neuropathy Treatment Centers of America, and the core of their treatment is infrared light applied directly to the affected areas, to the feet. And that is exactly what I've been looking for years, because I have patients that come into my office, diabetic patients. Diabetes in this country is absolutely epidemic. And one of the complications from diabetes is peripheral neuropathies, problems with their feet. And I've been looking for a treatment plan to help those patients, because they come in and they tell me that there's nothing that can be done. They've been told time and time again there's nothing that can be done for this pain that they are suffering. That's why I was excited to hear about the infrared treatment, and then to find LED technologies that could supply me with the infrared panels. I was introduced to a firm in Phoenix, and they're called Neuropathy Treatment Centers of America, and he had done his work in Italy for 10 years. They're much more open to different technologies or different therapies for health problems, and he'd been using infrared light in Italy for 10 years, and he brought it back to the country. And I was extremely excited to find somebody that had a body of work for 10 years in hospitals that was exactly what I was looking for. Tremendous. Since I've started the infrared therapies on the extremities of diabetic patients, it's just been tremendous. The positive response from the treatment has been about 80% of all of the patients that I'm treating. 80% positive. That is no invasive therapies. There's no medications involved. It's simply the core of the treatment is infrared that increases the metabolism, allows the oxygen to flow again into the damaged areas, and it helps. The infrared light therapy has helped my patients tremendously. The vast majority of them have received extremely positive outcome to the treatments. Wounds are healing, the fear of amputations has dissipated out, and it's given the patients hope that they don't have to live on pain medications for the rest of their lives, and taking pain medications to be able to get 2 or 3 hours of sleep at a time. This is tremendous. It's really been a boost to the peripheral neuropathy patient base that I have. Some of the other areas that I use the infrared lights on are the hands. The Raynaud syndrome, especially up here in the Midwest during the winter months, a lot of patients come in with a Raynaud syndrome, which is a circulation problem in the hands, and their hands become extremely painful, red, and even at sometimes they turn pure white. And there is no treatment for that. They are told they have to live with that. And the infrared light 100% of the times takes care of Raynaud syndrome. I have treated patients with rheumatoid in their hands, and it's offered tremendous help, to the point where they can actually reach and grab hold of a bottle or a container and take the top off the container again. That's huge. My primary mission with my patients is to have the patient understand that they are in charge of their health. They are responsible for their health, and if they take the small steps on a daily basis that they need to take, eating healthy food, getting some exercise, being careful of what they do to their body, they can live a long and happy life. Too many Americans depend on drug therapy for their health care, and it just simply isn't working. It's too expensive, it's too dangerous, and it doesn't work. Americans need to take care of themselves. We're responsible for this. It takes a little bit of eating some healthy food, pushing yourself away from the table, and go out and huff and puff around the block a few times. That's all it is. The trade-off is that you're healthy. The trade-off is that you keep your money in your wallet, not the drugstores. That is my main goal. More Americans are turning to alternative forms of health care. For problems with circulation, with problems with arthritis, with problems with injured joints, Americans are turning away from the pill in the bottles and looking for alternative health care. Infrared light is a no-brainer. Infrared light is different than visible light. It penetrates deep into the tissue. And when it penetrates deep into tissue, it allows metabolism to increase. And when metabolism increases, it opens the blood vessels and oxygen can be carried to the damaged tissue and itself heals. It heals itself. It's a great technology. It's very simple. It's very basic. There's no side effects to it. In my office, I've seen results, positive results from the LED technology from their panels. I've seen results anywhere from 1 treatment to 20 treatments. These are people that have been on gabapentin and Neurontin for 10, 8, 6 years, taking 3,000 milligrams of Neurontin a day to try to get through the day. And I've seen these people anywhere from 1 treatment to 20 treatments and receiving excellent, excellent results. What I do in my practice, because I'm in a small town up here in northeast Nebraska, I have people that drive an hour and a half one way for treatments. So after the initial 10 treatments, most of my patients will ask, how can I continue this? What I do is I just simply have them buy a unit to take it home and self-treat. And they're absolutely elated to do that, because if they have gotten 60 and 70% better in the last 10 visits, they want to get another 20 or 30% better. And I have no difficulty talking to these patients about taking a home unit with them, and they're more than happy to do it. They can treat their feet themselves, they can treat their neuropathies themselves, they can put it on their husbands and wives who have bad knees, they can, for the rest of the family with their other arthritic problems. I want people to come in so that I can monitor them the first part of their treatment, their first 10 office visits. I do some manual therapies on them when they're in the office. I make sure that they stay on their supplements. We do some supplementation. But then after that, I just want them to get better. It's just my, I don't need them back in my office. I want them to be able to go, I'm at 70%, I'm out going to the grocery store, I'm sleeping at night, I'm not on my drugs any longer. They can go on their own. I have them come back in a couple of weeks. We recheck everything. We do another sensory testing to see how they're doing. But basically, they're on their own from that point out, and that's great. That's absolutely fantastic.
Okay. Okay.
These people have their life back. As far as how the treatment affects the average patient's life is, first of all, they're not living in fear any longer. It's very fearful for a person to have the feeling of no control over their health. It's just getting worse, and there's nothing they can do about it. They're eating, they're taking a lot of medications, and that's not helping, and that causes fear. But again, the primary thing is they can get up and go to the grocery store. They can go out in the kitchen and cook a meal and stand there in front of the stove and cook like they've been doing for their entire lives, and their feet don't hurt. They can go visit their grandchildren, and they can go for a walk. And that's tremendous. Having a person be able to get up and go walk around the block to enjoy a beautiful day as opposed to sitting in the living room with their feet propped up in the air, it's tremendous. It gives them their life back. My main objective when I have patients come into my office is to have them take control of their health again. Most Americans do not. Between 25 and 45, we can mistreat our body pretty severely. Between 45 and 55, all kinds of problems start to show up. And then between 55 and 65, a lot of Americans are in deep water. They're in hot water. So what I try to get my patients to realize is that they're in charge of their health. It takes a little bit of work. It takes watching what you eat and drink. It takes getting up and walking around the block and getting some exercise. But that's the trade-off is huge. You live healthy and happy. You keep your money in your bank, not the doctor's office, and you can enjoy your retirement years as opposed to financial hardship of heavy medications and surgeries and loss of mobility. The loss of mobility is one of the greatest problems with the retired generation, the Medicare generation. They can't get up and walk down the street. They can't walk around the grocery store twice to go get what they need. So my main goal is to have people take control. They're responsible for their health, not the doctors, not the hospitals, not the drug companies. Take control of their health, and it'll pay off in the long run. DPL therapies has allowed me to offer patients that previously have had no option, no treatment options, allowed me to give these patients a treatment option that can change their life, that can give them back their hope, and allow them to live their final years in health. It's been tremendous.